So the University of Johannesburg has become the latest tertiary institution to make COVID-19 shots compulsory for those who want to access its facilities. Staff, post-doctoral research fellows and students will need to provide proof of vaccination before entering campus. The policy also applies to contractors and visitors. The university says exemption based on medical or religious grounds will be made. It says it will balance the rights of individuals against the rights of the broader university community. We get reaction on this. We're joined via video line by Wendy Nkosi, UJ SRC Secretary-General. Thank you very much, ma'am, for your time this afternoon. Your reaction to this decision?
Well, our reaction has been quite simple, that we feel like for the university to just take such a haphazard decision on implementing a policy that has not been very much researched by the university, it's quite saddening from our side. And we've been saying from the get-go that there should be more consultations, more human-related interactions with the students, because we interact with students on a daily basis with different backgrounds, and we feel like so many students have not been answered in terms of the questions that they have that we don't even have as SRC. And we've been telling management that maybe it's time that before we can implement such a decision that will affect all of us, we should have an interaction and a conversation that will ensure that every student in the University of Johannesburg is accommodated. So hence why we're just rejecting this policy. And until the university ticks all the boxes that we have been requesting from the get-go, we will not be abiding by this policy at all.
We'll run through the checklist in terms of what it is that you are wanting in a moment, but you call this a haphazard decision with no research having been done. As we understand it, on the 21st, right up through till the 26th of October, the university conducted a survey among students. This does not satisfy you?
No, it doesn't, because out of the 50,000 students, only 2,751 participated. And we feel like if that was the reaction from the students, we're supposed to go back to the drawing board and actually find other ways of how we can get students to interact, because just having a survey is not enough.
So the survey is not enough. You mentioned earlier that the university did not tick boxes, that you had wanted. What is it that you are proposing?
Well, basically, number one, I feel like we should have more health experts that will come into the university and interact with the students, taking all the questions that the students will have. Number two, bringing legal experts that will come in and bring the legal opinion about the mandatory vaccination, good or bad, because I feel like we're getting from a one-sided story and we're not getting both sides, and then we'll leave it up to the students to decide whether or not it is fit for us. Lastly, we have so many students that believe in African traditions, that are taking different traditional herbs for different reasons. And the fact that it is not addressed, it poses the question, are we a diverse university, or we are only accommodating what students that we feel like are going to be in line with what the university is implementing? So I feel like every student's question should be addressed, every concern, whether we think it is health related or not. But the fact of the matter, now that we're dealing with health, we should take all the necessary precautions, because we do not know what this policy will be breeding next year.
You mentioned that you were not consulted by the university. We did try to get them to come onto the program to explain further in terms of this policy that they have announced, but unfortunately they could not join us, making an indication that perhaps they will start speaking on Monday. In terms of processes of the university, is the SRC always consulted in matters of policy of the university? Is this an exception to the rule?
We are consulted at times, and if we feel like we are in disagreement, we always write down our submissions and we report back to them. And unfortunately, there's always a room of engagement, but we are always, what's the right word? We are always not winning in terms of these matters, because they are coming at a perspective of the university. We are coming from a perspective of students, and we never meet each other halfway. Hence, matters are always just implemented without actually the SRC being fully 100% behind the decision of the university.
We understand that a mandatory committee will be formed to deal with applications of students. What do you know about this?
Well, not much, because I actually made a comment in one of the meetings. I was like, well, the mandatory committee does not really stipulate the powers and the responsibilities and the duties that they will be doing within the university, because I heard that the mandatory committee will consist of people outside the university, and that's quite a concern, because now we do not know if the SRC will be there to actually hear who are the people who are making applications, so that we can draw a compare and contrast of what are the commonalities that the students are saying that they can't take the vaccine. So we're in the dark actually, because the policy itself is quite light. It's not stipulating who forms part of the committee rather, and so forth. So I really can't make a comment until the university actually tells us, and then we can challenge them from there.
Your suggestion of inviting traditional African experts who will assist students in taking traditional herbs, as you state in your statement, is this the position of the SRC, or is this something that students have actually told you? If so, what is it that they propose?
Well, it's not the position of the SRC. Every position that we take, it's from the students' engagement and interactions, on which many students, before you can even ask them if they've taken a vaccine, they'll be saying, and you can't really be judgmental, even though your personal beliefs do not align with that. So basically, everything will depend, once we get that expert who's going to come on board, who will be addressing all other issues that we may not even thought about, because it is a learning phase for us as well as SRC, because some of the matters we do not even take into cognizance until the student came to us and said, I can't take this because I'm taking a certain medication, which is obviously a traditional medicine. So what I can say for now is everything is a learning process, and we'll take it as it goes.
If you would allow me to be opportunistic at this moment and perhaps use the data that you have collected from students, right? So it is the Vuma vaccination weekend. And just in terms of vaccination or vaccine hesitancy, what is it that, your peers are telling you in terms of not wanting to get vaccinated? Why?
Well, one of the reasons was, number one, the president of the country hasn't really said that vaccine is mandatory. Number two, obviously, it's the traditional reasons of taking other substances. Number three, they're saying there's no site on campus, even though the university has said that there's a nearby hospital that we will be using, but the students still feel like there should be a site on campus that will be allowing students to vaccine and also test for COVID-19. Those are just one of the many main reasons why students are saying they're not taking vaccines. And some of them are saying that it's my right not to take a vaccine, that I feel like it hasn't been much tested on ensuring that it actually is helpful.
Wendy Nkosi is the UJ SRC Secretary-General. Thank you, Sissy.
Thank you so much.